Your eyes play a critical role in your overall health and the quality of your life. But are you doing enough to protect them? Well, today I'm going to share with you 13 simple science backed ways to keep your eyes healthy and keep your vision sharp. This is really important as we get older. I am going to share some pro tips to keep you successful, and you do want to stay to the end because number 10 is often overlooked, but is also important. My name is Dr. Diane Thompson. I'm a physician and I'm passionate about sharing information on healthy aging and longevity, particularly for those of us over 50. Tip one is to schedule regular eye exams. You want to have comprehensive eye exams usually by the age of 40, and you have evaluations every 1 to 2 years thereafter. Obviously, if you have any symptoms, any issues in between, schedule that appointment early. Things like glaucoma, they don't necessarily, that particular disorder doesn't necessarily have early warning signs, but you can catch it early and you can treat it early. And glaucoma is a major cause of blindness. I can tell you for myself, I got diagnosed with glaucoma suspect because I went in after a foreign body got in my eye, and we incidentally found my pressures were slightly elevated. We looked at my family history, etc. So go in and get checked. A pro tip is to bring eye shield or sunglasses when you're getting checked, because typically your eyes will get dilated and you want to protect it from the sun. Also, bring in your list of medications. Some drugs can actually affect your vision, and you want your doctor to know that. Tip two is to wear daily eyewear that are UV protective. The ultraviolet rays can put you at risk for cataract, macular degeneration, cancer of the eyelid. It can damage the eyeball. And so you want to protect. A pro tip is to look for a label that says 100% UV protection. And if you want to give added protection, wear a wide brim hat. Tip three, if you smoke, stop now. There's so many reasons to stop smoking. Your eye health is definitely one of them. Smoking doubles your risk of developing cataract and macular degeneration. And again, these are leading causes of blindness, right? The good news is it's never too late to quit. And when you quit smoking, you will significantly reduce your risk of further eye damage. Also, it will improve other aspects of your health, because smoking is dangerous to so many things, right? Your future self will be grateful. A pro tip is to talk to your primary care doctor if you smoke and you need help with cessation, because there's so many resources out there. I am going to share links for that also below. Tip four is to protect your eyes from trauma by wearing goggles. I can't tell you how many times I've passed construction workers out on the street. They're working and you see the debris going close to their eyes, and they don't really think about it. I've stopped and I've educated them. Some of them are receptive, others kind of roll their eyes, but I do think it's my role to say something if I see something that could go wrong. Think about things like when you are playing certain activities, certain games like racquetball or mowing the lawn, if you're doing major home repairs, even cleaning, if you have caustic chemicals coming close to your eyes, protect them. A pro tip is to look for the American National Standard Institute, ANSI. They have safety standards for goggles. Tip five is to practice computer screen etiquette. So this includes keeping your computer screen at arm's length and usually below the eye level. This will help prevent dryness and discomfort. Blink often to avoid computer vision syndrome. This is the fatigue that comes when you're focused too long on the computer. So you want to blink often. The third thing is to take breaks from your computer screen. You want to give your eyes a chance to rest. And you want to adjust the light on your computer so it's not too dark or it's not too bright. A pro tip is to practice what's often called a 20-20-20 rule to prevent eye strain. And what this is you basically take a break every 20 minutes. You focus on an object that's 20 feet away for at least 20 seconds. Tip 6, take care of the makeup that you use. This is typically for women. Throw away the mascara, the eyeliner after about 3 months, or if it's expired. You want to avoid bacterial buildup. Also, if you've had an infection, throw out the eyewear also, right? And a pro tip, don't share eye makeup. Tip 7 is don't go to sleep with your eye makeup on. Leaving makeup on can clog the tiny glands along your eyelash, leading to infection or dryness. So remove makeup nightly. A pro tip is you can use warm compress. That might help to keep the glands healthy. All right, if you're gaining anything helpful from the tips I'm sharing, please do me a small favor and like, share, and subscribe. Tip 8 is to eat your way to better vision. Things like leafy green kale, colored spinach, these are loaded with antioxidants. They protect you from UV damage. Orange vegetables like carrots, sweet potatoes, they provide beta carotene. This is going to help with night vision and lubrication. What about nuts and seeds? Almonds and sunflower seeds, these fight free radicals, and they are high in vitamin E. Omega-3, this is going to reduce inflammation and support retinal health. And sources of omega-3 include cold water fish like salmon and tuna. But if you're plant-based, those options include flaxseed and edamame. A pro tip is to prioritize getting your nutrients from a healthy diet instead of relying on supplements. Tip 9, stay active. There's so many good reasons to exercise. Exercise is not just good for your heart or your brain, it's also good for your eyes. Regular cardio exercise helps to reduce diabetic retinopathy and keep your vision sharp. You want to aim for at least 150 minutes of moderate activity. So we're talking about brisk walking or swimming per week. Pro tip, always, always, always check with your doctor before starting an exercise program. You could have an undiagnosed issue, something underlying that nobody knew about. We want to make sure we take care of your health before you start an exercise program. Tip 10, often overlooked. Chronic diseases like diabetes and high blood pressure, you want to manage these. Both diabetes and high blood pressure, they can cause damage to your retina. Diabetic retinopathy, for example, is a leading cause of blindness in working age adults when you're most active and productive. So we want to maintain normal blood sugar and blood pressure. How are you going to do this? Follow the pillars of lifestyle medicine as I've shared with you before. This is a great way to manage chronic diseases. This includes focusing your diets around plants, so plant predominantly eating, avoiding processed foods, moving your body, exercising, consistent exercise, good restorative sleep. You also want to make sure you avoid smoking and alcohol, and you want to stay connected. All right. A pro tip is if you want information on lifestyle medicine physicians or other health coaches, go to the American College of Lifestyle Medicine, their website. I'm actually going to share a link to that below so you can access help. Tip 11 is to wear prescription glasses if they are needed. Age-related farsightedness, also called presbyopia, often start around the age of 40. And if you're having issues with your vision, get them checked like I told you before. And then you may be prescribed appropriate corrective lens. A pro tip is, in the same way you shouldn't be sharing medications, don't share glasses because you and that other person might have different corrective lens, right? So go and get your own and use your own. Tip 12 is to monitor vision changes. If you notice that there are any changes with your vision, don't avoid it, don't ignore it. Hazy vision, difficulty distinguishing colors, floaters, all of these, you go to the doctor immediately. Sometimes these visual changes may even indicate neurologic issues, so do not ignore them. please go ahead. I always say to you, prevention is the way to go and early diagnosis. A pro tip is to check with the American Academy of Ophthalmology to get a list of eye doctors in your area. And I'm going to link that below as well. Tip 13, the final one, recognize early warning signs. Common signs of eye conditions, they could include difficulty distinguishing objects from the background. And this could indicate several things, such as cataract, macular degeneration, for example. Flashes of lights or new floaters could possibly be retinal detachment. Sometimes a loss of central vision could represent macular degeneration or diabetic retinopathy. Again, look out for these signs and report them. A pro tip is, your eyes are such valuable asset and you don't want to lose them. So follow all the tips I mentioned below. Get your annual checks. Make sure that you report things that you notice. Do not ignore them. Make sure you are eating and moving and doing all the healthy lifestyle things to protect your eyes. Now, which of these will you be doing? Share in the comments below, and don't forget to like, share, and subscribe.